We're going to take a closer look tonight at the debate brewing over President-elect Obama's potential pick for Surgeon General. CNN's Dr. Sanjay Gupta, turning a doctor who's on TV into the nation's top doctor. Proponents ask, when was the last time you knew who the Surgeon General was? Picking Gupta would solve that. But opponents argue there should be far more to the role.
Good morning. Welcome to House Call.
Normally reporting medical news, this week Dr. Sanjay Gupta became the news. So far he has been silent about whether he'll accept any offer to be Surgeon General. But other voices have quickly filled the vacuum.
And it was hard for Obama to make the choice. It was between a Gupta, Dr. Phil, and a guy on Scrubs. I don't know what that is.
There are many, though, who are not laughing, arguing the doctor on TV shouldn't become the nation's top doc, the doctor who would advise the president and the nation about health and disease, and lead some 6,000 uniformed health officers across this country.
He obviously knows a lot, and he spent a lot of time reporting about all kinds of things in medicine. But still, it's not the same as spending 15 or 20 or 25 years working in various public health locations, working in these issues, and working in the government.
During the Clinton years, Gupta was a White House fellow, advising then First Lady Hillary Clinton on health care. But some argue years of service in the public health arena isn't necessarily what's most important.
One of the reasons that it is a good pick is that Dr. Gupta is already recognized by the public, and one of the key roles of the Surgeon General is to communicate with the public.
The 39-year-old doctor embedded with the Navy medical unit in the Iraq War, drawing attention when he performed surgery on an injured Iraqi child. He reported on the health crises after the tsunami and Hurricane Katrina. But his reporting has also stirred controversy. Some of Gupta's facts in his critique of Michael Moore's documentary on the nation's healthcare woes were wrong. Gupta apologized to Moore.
We want to get these facts and figures right as a doctor and a journalist, so we corrected that.
But proponents argue a Gupta appointment would bring renewed prominence to the role. Not since the Reagan years has a Surgeon General been a household name. Dr. C. Everett Koop spoke out against cigarette smoking and spoke publicly about AIDS at a time when the president was largely silent.
Let's stop the rumors and misinformation about AIDS.
President George Bush's Surgeon General resigned in 2006, claiming he'd been muzzled by the White House. Since then, the position hasn't been filled, which is why health advocates on both sides of the Gupta debate say Obama's choice now takes on even greater significance. Our closer look for tonight. We do have a health alert to pass along this evening. Minnesota officials have issued a warning for King brand peanut butter after finding one jar contaminated with salmonella. It's the same strain of the bacteria that has sickened nearly 400 people in 42 states since September. You can find the CDC's latest advice on the outbreak at our website, abcnews.com.